In the next segment, I want to speak with you about debunking some myths. Once again, the Mayo Clinic website is a good resource. There are other good places such as the Center for Addictions and Mental Health. And as you know, the internet is a good tool but needs to be used wisely to get accurate information from a reliable source, remembering that there is no correct answer out there and information is changing. So, does the pneumonia and flu vaccine help or harm you from getting COVID? There is no evidence that it harms, preventing you from getting the flu, which is a respiratory disease, which will end up with you likely getting pneumonia if you're elderly. Protecting yourself most certainly is helpful. Saline nasal wash, drinking hot water, using antibiotics, alcohol and chlorine spray, drinking alcohol, UV lamps, disinfectants taken by mouth or are not helpful. People ask about supplements. Asians are known to have vitamin D deficiency as a group. If you're going to use vitamin D, use the guidelines. Using in excess may lead to harmful effects. As to whether it would be helpful in COVID is debatable. Use of things such as zinc, aspirin are not based on science. People have asked about garlic, onions, various natural health products. There is no evidence that these would effectively make a difference. Things that make a difference are masks. Today, significant scientific evidence it prevents or to be accurate reduces the risk of your transmission if you have COVID, and it also reduces the risk of you getting it if you are wearing a mask. The virus gets into your system through your nose or your mouth or your eyes. So, washing your hands frequently, not touching your face, is helpful. The virus, for the most part, does not travel beyond 6 feet and does not stay in surfaces for long period of time. So the social distancing is important, and washing your hands, wearing a mask adds to a compounding beneficial effect. Finally, you have resources available to seek out help. If your excessive worry is affecting your quality of life and level of functioning, that is, your interpersonal relationships, your ability to have recreation, hobbies, your ability to function as a student work, then it is time to seek professional help. If your emotions are dysregulated to the point that it affects you personally, you're unhappy throughout the day, or worry throughout the day, or it affects your relationships with others, you have been given resources to contact. If your brain is foggy, that you're forgetful, you can't concentrate for a period of time, and you can't do it at the pace at which other people are talking, then you need to seek help. Finally, if you're not sleeping, your appetite is low, you feel excessively fatigued, you have a loss of intimacy, these are danger signs. Family physician would be a good resource. Information from places such as the CAMH, Center for Addictions and Mental Health, Mayo Clinic, seeking out is another resource. When the worry becomes a disease, generalized anxiety disorder, clinical depression, or major depressive disorder, and other diseases in that spectrum, there is help. There is talk therapy called cognitive behavior therapy, and there are medications. Word about medications. These medications are safe. They have been tested on children, elderly, pregnant women, and breastfeeding mothers, just to give you some idea of the confidence. They are important to be taken just as much as if you had diabetes, hypertension, high cholesterol. These are important discussions to have. I think it's also very important that you look at talk therapies, cognitive behavior therapy in particular, mindfulness, and meditation, the beneficial effects on the brain and the positive effects on brain cell growth, positive effect on neurochemical changes, and the role of psychotherapy that is available to you. Today, given the COVID situation, psychotherapy is effectively carried out through video conferencing. There are vehicles such as the Ontario Telehealth Network or the internet you can use, or telehealth through telephone and e-health through emails, all of which can be effective means of bringing about positive changes. Cognition is our ability to concentrate for a period of time, and do that at a certain pace, take in information, process that information, go into your memory bank, pull out past information, reprocess that information, make a plan, carry it out. We do that instantaneously, and they generate emotions. These emotions, when they are negative, a therapist can help you analyze your thoughts, reorient you to think differently. And the amazing thing is that they bring about positive neurochemical changes in the brain, which we can see with things such as functional MRIs and the shrinkage of brain cells that is associated with these diseases. They get back to normal size. So I leave you with some positive thoughts that with a vaccine, there is hope. That's not to let your guard down, because for the next 6 to 9 months, we would need to maintain the vigilance. Leave you with the positive thought that we can do simple things, do it over and over again, and bring about a positive change. I leave you with the thought that there are people whom you can reach out to, professionals and non professionals, who can help all of us to get through this together collectively. And the vaccine are promising, and we'll speak about it at the next session. Take care, stay healthy, and stay safe. Bye.